Okay, we're live. How are you, Dr. Madeline?
I'm great. How are you, Dr. Terralon? Thank you for
Okay,
having me.
I think we're getting a little feedback, so let me know how the sound is on your end.
Okay.
Happy Monday, everybody in Facebook land. Thank you for joining us. I am so excited about our guest today. I'm going to turn it down, getting just a little bit of feedback. Happy Monday. It's a great day here, a little muggy in the DC area, but I'm happy to have everybody here. So excited about our guest and our topic. Hide your kids. It's going to be a grown and sexy topic tonight. But it's going to be an educational one and a much needed one. So very, very happy. I'm Dr. Terralon, your board certified family physician, speaker, author, and best-selling author. We're going to claim that as of this week, and career transition coach. I help medical professionals make pivotal changes so that they can find careers that allow them freedom, flexibility, and financial independence. You can follow me on all social media platforms at Dr. Terralon. That's DrTerralon. And you can buy my upcoming best-selling book. That's I Kiss Clinical Medicine Goodbye. And you can buy that at kissmedicinegoodbye.com. You see that scrolling across the screen. That's kissmedicinegoodbye.com. Thank you for joining us. And I'm so happy to be here with my special guest, renowned, I'm going to say world-renowned, Dr. Madeline. Yay! She is an OBGYN of over 20 years experience. She worked at the CDC. She has delivered hundreds, we're going to say thousands of babies, has helped thousands of women be in control of their sexual health, their reproductive health. She has worked with the Public Health Service, and that's just a little bit, but I'm going to give her the floor and just have her introduce herself so that we can get into today's topic. So thank you so much, Dr. Madeline, for joining us. I'll give you the floor.
Thank you so much for that. Thank you so much for that generous introduction, Dr. Terralon. Thank you so much. And congratulations. I'm so excited about your book this week. That is awesome news.
Thank you. Thank you.
So that'll be great. You might hear my puppy in the background. Someone's moving past the window. But thank you again for the invitation. I'm so excited to be here. I am Dr. Madeline, board certified OBGYN, Amazon best-selling author of In Control, and international speaker. I love working with women, whether they're busy inside or outside of the home, to help make sure they have access to accurate GYN information and birth control so that they can have the most freedom and control over their lives that they desire. So I am so excited to be here this evening. Thank you so much for the invitation.
Thank you so much. I can't wait. I've been reading your book and I just can't wait to get in it because I think we really, really need to, there's so many interesting topics and we really need to get into it. Just one second, Dr. Madeline. So I highlighted some great comments that I really want to get into, but I want to start out with what made you write this book? What made you write it? Can you hear me?
Thank you so much for that question, Dr. Terralon. You know, women's health and sexual health is something that's been near and dear to my heart for a long time. Yes, I'm an OBGYN by training, but also when I was at Centers for Disease Control for 21 plus years, my area of specialization was in sexual health. So I worked in STD prevention and HIV prevention, which among women, HIV is mostly sexually transmitted, right? So what happened when I was trying to figure out what I was going to do after I retired from CDC, I knew I was continuing to empower women and them and feedback that they could use on their journeys towards health. So it was an interesting time. I went through a personal life transition where basically, I'm a busy working mom, like you, we're out here working in the streets. I like to say that we, were out there doing what we needed to do and also doing what we needed to do at home. And I reached this point where I was kind of too thin, where I was, trying to knock it out at work, trying to knock it out as a mom, trying to knock it out as a partner. And it just became too much. And so when I began to scale back and realize that I needed to prioritize me more so that I can get all those things done in a way that was healthy for me, I needed to shift some things. And so that shift changed what my and that was okay, because after I got to the other side of that shift, I was stronger, I survived, and I was thriving. And I was like, okay, well, what did I learn during this journey that I might be able to share with some other women? And also, what have I heard my patients tell me over the years that I might be able to pull into some information that might be helpful for even more women? And so, it's interesting. One of the things that happens with, us with years is if we are born female and we go through our first cycles, usually around age 11, and then we go through life and we go through menopause, usually around age 51. Those are the average ages. Then we have about of our lives where if we're having heterosexual activity, then those are all years that we can risk getting pregnant, right? Now, children are a beautiful thing, but if you have a child every single time you have sex, it's problematic. And so between listening to my ladies and what they were feeling and infusing that with some of what I was feeling, I knew that it was important to make sure women had accurate information around birth control. This whole, sex thing and being able to enjoy sex, like truly enjoy sex, worry-free, joyful sex, really is a combination of two things. One is knowing and using birth control options that work for someone as an individual. The part of that is to the extent that STDs are real and HIV is real, having sex in a way that protects you from getting something or being exposed to something that requires treatment, whether it's short-term or long-term treatment. So that's kind of behind my stimulation with this book, really trying to help as many women as possible get to free, joyful sex.
And I love that you've created a safe space for us, and the way that you talk about it so freely, and you've created a term throughout your book that you use it. You use the words control and you use the words worry-free joy, and I love that you make it seem. You've created this safe space, and I feel like the more that we talk about it, the less taboo it is, and I always say that, your patients must feel so comfortable talking to you. I know I do, and this is an open forum. I took some screenshots, and I want to show the viewers the reason why I don't have the hard book is because I'm using the Kindle version. And I want to encourage folks, if you see the incontrolbook.com and scrolling across the screen, you can go to Amazon right now. And like I said, I took some screenshots from my Kindle. I'm using my Kindle right now. I highlighted and made notes. I'm trying to get better. I'm trying to get better at using like the notes section of my Kindle. So I highlighted some things that you wrote in the book, and I love what you said. You said, I had more freedom and I formulated what it would look like to help other women, whether partnered or not, access more freedom. And that became my purpose, because freedom looks different for every woman. Although some parts of women's struggles are similar. I love that. And so I'll just read it one more time. I had more freedom and I formulated what it would look like to help other women, whether partnered or not, access more freedom. And that became my purpose, because freedom looks different for every woman, although some parts of women's struggles are similar. I love that. And so I had to highlight it so much, and I wanted to just share that with the audience. I have one other. quote. So I know that part just touched me. So I have a couple of other parts that I highlighted in the book. So just wanted to share that. That was really touching.
Thank you. Thank you so much for saying that. You know what? Oh, I'm sorry. So you know what happens is when we are seeing patients and taking care of women, we see people across so many different cultures and backgrounds, right? And so, yes, freedom for me looks one way, but if I'm seeing, one of my ladies from another part of the country or another part of the world, freedom may look very different for her. Freedom can be different if someone is single or solo or partner. And so, what I try to do, and whether I'm seeing a patient, one-on-one in an office or in a big setting, like, giving a talk, I try to keep a judgment-free zone. So I love that you like that I wrote it. I try to write it in a way that everyone that, this is a safe space. It is judgment-free. And so whatever freedom looks like for you is, I would love to help as many people as possible, as many women as possible get to that freedom, whatever they envision that for themselves. So thank you, Dr. Terralon, for reading that part.
No problem. And while we're talking about creating a safe space for people who have questions, maybe about their sexual health or just reproductive health in general, if you don't feel like posting a question, but you do have this burning question, what you can do is send me a DM, and I will ask that question to Dr. Madeline now, if you're present now and you don't want to post it. But if you're bold enough and you feel, if you're courageous enough, then please feel free. We want this to be, we definitely want this to be educational, because if you have that question, trust and believe that others do. And let me tell you, there is no copay right now to see Dr. Madeline. I don't know about you, but I have to pay a copay to see my OBGYN, just like the rest of you. So take it full advantage. And many of you know, a lot of us still can't go into the office just freely to see some of our OBGYN. So take full advantage of this time to see Dr. To ask Dr. Madeline a question if you just want to, if you're curious, and we will do the best that we can right now. So feel free to send me a direct message if you have one, and I'll try to relay that right now. The other, know that we are not, what's our disclaimer, Dr. Madeline? Let's give a disclaimer right now. This is,
Yes. So we definitely want you to follow up with any specific concern. Yeah, any specific concerns, definitely see your primary provider, OBGYN or primary care provider, even if they're not an OBGYN. But certainly we want to give general feedback and guidance that can help you be more targeted when you do follow up with your. So yes, we welcome any questions. We will help guide you to the right source.
Thanks. And I'll be checking some of them now. Some of them. Thanks, Dr. Madeline. Now, some of them don't show all. We're using StreamYard, so I will try my best to check all of them, because some of them don't come through all the way on StreamYard. So I'm going to do my best to check all of the platforms. The other thing I wanted to highlight in the book is I love that you don't just address control or birth control for just women. I love that you do it for men. I saw that you discussed condoms, vasectomies, and other forms of birth control for the men, because I mean, we have to talk about it for the partner and educate the women and the men as well. And so that was really, I thought that was very interesting and important as well. So it's not just a book for women. The men should be picking it up as well, I thought. So can you touch on that a little bit?
Sure, Dr. Terralon. Well, trust me, questions about women birth control, that's one of the things that I get asked about a lot when a woman is in my office, because, for many women, I'll say, quote unquote, the burden of birth control and preventing an unplanned or unwanted pregnancy usually falls on the woman. It's not fair, we know, but that's just how it has been in terms of what science has provided us so far. And so I will make sure that in the book we talked about that. And I gave it a title to make sure that people knew it is what it is. It's a short chapter because we just don't have a lot out there. But at least there's science happening. They're exploring some things that men might be able to do outside me. And even if a couple, a male and female couple, decide that they do want to go with a vasectomy, it's actually easier to reverse than even if a woman were to get her tubes tied. Both of them are, getting the tubes tied, but one is easier, less anesthesia, faster, easier to reverse the vasectomy compared to the tube tying for women, which is, we always counsel women that having your tubes tied should be considered permanent sterilization. It shouldn't be thought of as oh, we're going to tie and then you can untie them later. That's usually not how it works. We usually will tie, cut, and burn, and it's definitely a more advanced process compared to a vasectomy in men. And so definitely we spend some time talking about that. We spend time talking about condoms and how effective they are compared to other types of birth control. The beautiful things about condoms, though, and I include some condoms in the control concierge box that you have strolling along the bottom there. And I include these because for those who are having heterosexual sex, condoms are great because they will provide protection against both sexually transmitted diseases, including HIV, as well as pregnancy prevention. And so I think they're always a good thing to think about when people are thinking about sexual activity. Now, one caveat though, condoms don't protect 100% against herpes simplex and other type of viral infections that can be on the outside of where the condom covers. And so I just wanted to throw that in there as but yes, absolutely. Birth control is a partnership. It should be thought of as a partnership. And while women have the brunt of the hormonal options and the non-hormonal options, there are some things that their male can do as well. So yeah, I wanted to make sure we cover.
So I'm sorry, Dr. Madeline. We might be having a little, I don't know if it's my connection or yours, but you did a great segue into your concierge box. And let's talk about your concierge box. I happen to have a sample of it here. You already mentioned the condoms, but let's talk about these wonderful little necklaces and the condoms. So I'll let you take it away. I have a sample here, and you just let me, you tell me, you guide us through it, and I'll show the samples that I have here. So take it away.
Oh, well, thank you for that, Dr. Terralon. So here's the thing. When a lot of times, and you said it earlier, that a lot of times sexual talk, these conversations have been taboo, right? So for many women, even talking about sex is brand new. And so one of the things I wanted to do, in addition to making people have information about birth and all that, but I also wanted to create something that would allow women to begin to explore safely. What does sexual health feel like for you? What does your sexy feel like for you? What parts of your body do you enjoy being touched in a certain way? What is that touch like? And so when I created the control concierge box, my thought was to create, and here's a phrase that I love, sexual zen. And so, create a full space, something that, gives you good energy, and then just go for it. Whether you are alone or whether your boo is right there next to you, just go for it. And so in the box, I find some things to allow for that space to be created. And so, and thank you, Dr. Terralon. I know you have a box there as well, but one of the things that always is great for helping one of the things that's always great for helping to set a mood is candle. Yep. So I put in there a worry-free joy candle.
Yes, I have my candle.
Yes, and it has and I love it. It has some great kind of lavender and sage scents, really some scents to try to help mellow us out, and get us in a different mood. I included, I don't know if you have the little pouch there, I included a little pouch.
Oh, okay. I don't have my black pouch.
Awesome.
I do.
You have the red one. Awesome. The red one has a little travel candle. So this one here is really big, but as people start traveling again, so this one is for home. As people start traveling again, I put a little travel size candle in there because sometimes when you're getting your sexy on, you got to leave the home. So you don't necessarily want to take the big one. You just want to take the small travel size one. So that's why I included that one in the box as well as an option.
And it has Zen on it. I have that one. And y'all, look. So Dr. Madeline's so thoughtful. She included the matches for unprepared people like me.
Yes. Yes. My goal was, Dr. Terralon, I'm like, a woman opens this box, I don't want her to have to open it and think, oh my goodness, I got to run to the drugstore. You know that feeling on Christmas when you used to be little and you would open that toy and there were no batteries? So I was trying to get us away from that feeling of, oh my goodness, I got to run get some batteries. So I want to tell you guys about the other thing that's in the box. So this is basically a beautiful necklace. We can wear it as a necklace, but it also detaches to become a clitoral stimulator. And so you can detach it from your necklace and you can plug it into the device that goes with it. Okay. And then you just kind of turn it on and it causes just a little vibration, and you can change the speed of the vibration. And it's not meant to go inside the vagina, but it's just meant to touch the clitoral area right below the clitoral hood. I do spend some time in the book talking about just that, so that
wait a minute,
kind of clear about where things
go. Okay, all right, I got it all.
You got it? Okay. And then you put the
don't try to laugh.
Do you already? Now I included some batteries in it. Do you already have batteries in here?
Yes. See, I told y'all. Look how thoughtful Dr. Madeline is. Okay, I got my batteries. Yes, these are my extra batteries. But yes, I already put my batteries in.
Okay. Excellent. Oh, that's what I'm talking about, Dr. Terralon. And so the top button, push that.
Okay.
Just,
yes. I got it. All right.
No, this is a safe space. No one can tell Mama. So you push that on. You can basically experience.
Yeah.
And then you just play with it, and you play with it until you figure out what you enjoy. What?
Yeah.
Yes.
Yeah, it has a couple of
it goes off.
Y'all can't tell. Y'all have to buy the little speeds, the little vibrators. It's very subtle, y'all. So
yes.
But no, this is
it allows people to be discreet.
So I love that. You couldn't even tell. See, I bet you guys didn't even know this cute little necklace that Dr. Madeline and I were wearing were little vibrators. So, and what I love about it is this was created by a physician. So for you guys who are buying all of these little gadgets that were made by, any Yahoo out there, this was created by a physician. She actually saw a need. She listened to her patients. And she has a book that explains the science behind everything. She's worked at the CDC. She's worked at the Public Health Service. She knows the anatomy of a woman. And so she saw a need, and voila, and this is what you have. Let me see. My cousin is typing something. Let me see. I can. Okay. My cousin said he's here. Okay, so you can buy something for your wife. My cousin Karanja is here. So, all right. So, did you hear me, Karanja? Okay. All right.
Awesome.
Questions there.
Thank you. Well, thank you for that. So those were the thoughts behind creating the box, and I really wanted to have something that was allowing women to just feel and think about themselves. We spend a whole lot of time thinking about others, but this box is just for a woman who just to give herself some time and space and enjoy herself, you know?
Yeah.
So that was behind the box.
And can I say that I'm really, really proud of you, and just I think this is a great example of a physician thinking out of the box and really thinking about her patients, seeing a need, seeing something that her patient wants, and actually putting thought into it, and also thinking about discretion. This is something very convenient that a woman can wear, and no one thinks otherwise. It's just a necklace is fashion. And I'm sure you have other thoughts and other things coming down the pipeline. Also, I love the fact that you were very thoughtful about a candle. You were also thinking, this is also ties into your history of working at the CDC and the Public Health Service. You're thinking about safety because, again, you're, like you said, oftentimes the burden of birth control, or not just birth control, but also being safe, falls upon the woman. And so here you've also thought about, I don't have my black bag with me. I have this big red bag, but I do have the black bag upstairs. I didn't bring the whole box. But again, you have this small black bag and sometimes the red bag here packed away, where a woman can have this in her purse or pack this away in maybe her overnight bag, complete with the condom, the candle, and the matches. And even if she wants to use the vibrator for herself, she has the batteries as well. So I applaud you for being so thoughtful and allowing a woman to take quote unquote control. So thank you so much, and providing the book that complements all of this, that provides the education. It's so important. So thank you so much for all of this, Dr. Madeline. Do you have anything else that you want to add? I feel like I've learned so much.
Thank you so much, Dr. Terralon. Just that I really hope that women begin to feel more empowered, and a lot of times, sometimes we don't think about it because we think, maybe people are embarrassed, or maybe it's a taboo subject. But as more and more of us talk, like you said at the beginning, the more we normalize this conversation, the less taboo it becomes. And so, I'm glad that and I'm thankful that you had me on here tonight, because hopefully if we read even just a few more with this conversation, and men as well, then hopefully we can begin to kind of open that gate a little bit more and remove some of those barriers, so that we can talk more openly and freely the fact that women enjoy sex too, and enjoy sex in a way that they don't necessarily always want to have it tied to childbirth. And so very important to create that distinction and allow women to know that it's okay to have sex without it leading to a child, whether it's a desired pregnancy or undesired, that things can be timed in a way that works for the woman. So thank you again for inviting me. I appreciate it.
No problem. Okay. My cousin says he has a question. I'm waiting for you. Go ahead, Karanja. I know there can be a delay, so I'm waiting for your question while I check the other platform. So go ahead.
Okay.
And I'm also going to check my DMs. Can you also check yours just in case, Dr. Madeline?
Oh, sure. I'm seeing here, Karanja says, my wife has extremely painful menstrual period every third month. Yes, now, the painful menses are certainly something that are common, unfortunately, and it's important. Hopefully your wife has a primary care provider or an OBGYN, but absolutely it's something that she should speak with them, because there are different things that we can do to try to figure out what's causing the pain. And then once the pain is identified, suggesting some ways to try to decrease the pain so that she's not having so much discomfort every third month. So hopefully that's something that is feasible for her to access care and get the situation if she hasn't done so. But thank you for that comment.
Okay, I have a comment from a friend who wants us to talk about vaginal dryness and the causes, maybe the causes and maybe some preventable measures for vaginal dryness.
Thank you for that question. So vaginal dryness is very common. Now, it certainly increases and gets older. The main cause of vaginal dryness has to do with a shift in our hormones. And so, as women get older and go toward menopause, menopause is a natural. It starts a natural decline, and most important, estrogen. And the estrogen is the hormone that drops suddenly and causes many of the symptoms might a woman might see when she reaches that point. Vaginal dryness is one of them. It's a very common one. She might also begin to have some that type of thing. But it's not just with women around the perimenopause. If there's a younger woman, let's say she's breastfeeding. Breastfeeding is another time, surprisingly, when the hormones are shifting a lot. And so sometimes you can have some vaginal dryness with the shifts that happen when a woman is breastfeeding. So both of those situations, whether it's due to like breastfeeding and some hormonal shifts around that, or some hormonal shifts later in life, there are different creams and medicines that can be utilized to try to help improve some of the secretions and normal vaginal secretions to decrease that dryness. There are pills that can be taken for women who are in men long term. There are many things that we assess at baseline to say to do that. That you can take a pill by mouth. Sometimes you can place the pill directly in the vagina. Sometimes you can use vaginal creams. You can use different lubricants that are over the counter. So there are a range of options out there. I think the most important thing if someone is experiencing vaginal dryness would probably be to start with a visit with their provider and have that provider assess what might be causing the vaginal dryness, and then you can make sure that they're getting the treatment that is aligned with what the cause is. So yes, and good luck. Good luck to the person who sent that comment in, and if they have any follow-up questions, just let me know. I also to follow up. Karan just said that his wife had fibroids, and he was a follow-up to the question about the pain. So fibroids, they're so common. I'm glad you asked that question. July is National Fibroid Awareness Month, and so more people talking about fibroids. Fibroids are usually benign kind of growths that happen on the uterus, and they can certainly be based on size and location. They can cause a lot of people extra pain. They can lead to heavier bleeding during certain times of the month. And so if that's been identified as the cause, then that's a good thing in the sense that your wife's provider is specific to try to target when they're talking about solution, whether something non-invasive like embolization, or whether it's necessary, depending on her quality of life, whether it's necessary to go in the path of surgery to try to reduce her pain. So thank you for the question. Hope able to get some resolution with that.
I have a follow-up question to the vaginal dryness, and that was, do you recommend any particular types of lubes or lubricants? Sorry. Are there any particular ones, Dr. Madeline, that you recommend, especially for women who are sexually active?
Mm-hmm.
Oh, I didn't know if you hear me.
Oh, yes, Dr. Taylor. Great. Yes. Great question. There are so many lubricants out there, but I want to make for one that I recently, because I know it works and because it's made and developed by someone who we both love and admire. So Dr. Dre, he's a board certified OBGYN, and he has a line of lubricants called Momentum Intimacy. Feel the moment.com as well. But he has full range, and they work very well. So lubricants, it varies based on the type of lubricant you're looking for. If you're using condoms, if you're using silicone sex toys, there are different types of lubricants that would be appropriate for different scenarios. And so, so I would definitely say, check. There are some could have like aloe vera in them. They tend to be um, trying to reduce the amount of chemicals that are in them so that they cause, women can enjoy, or anyone can enjoy them and feel whatever they're going for. If they use some of the silicone-based ones, those last a little bit longer. They shouldn't necessarily be used with certain types of condoms. The water-based ones are great as well. And so go there and look at all the different options, and definitely there's something there for everyone. But that's a brand of lubricant that I've tried recently that works very well.
Okay, thank you. And let
Thank
me
you.
see if there are any other questions that we can answer before we let you go. Let's see. I don't see any. I really thank you. And you guys are getting some great free advice that we would normally have to pay for. But also, I just appreciate Dr. Madeline just sharing her expertise, her years of experience, her craft, her purpose, her passion. I don't know what else I can say about her. She's just a wonderful person altogether. I'm checking other.
So much, Dr. Terralon. I feel the same about you. Definitely, I love what you're doing in terms of helping other physicians or providers who might be, trying to move away from the clinical area, helping expand their horizons. So doing that. And my apologies, most usually is not this loud. My apologies that he's barking in the background.
Oh, that's okay. He's just bringing attention. He's just proud of his mama. So I don't see anything else. And he's he might be a little hungry or just a little, he's attention seeking like other men, we know. So let me see. I don't think there's anything else. Any closing words? Oh, thanks. My cousin says 2 doctors, MDs that are Black and beautiful. And then he says something in French that thanks. That's my cousin. He's being sweet.
Oh, thank you so much. Thank you so much for those kind words. Well, I just want to say, I really appreciate the invitation, Dr. Terralon, to talk with you, to talk with your audience about the book, In Control, Everything You Need to Know About Worry-Free Joyful Sex, to talk about the fact that I want as many women as possible to get to worry-free joy. And so whether that's through, a book, talking with other women and making their desires known, whether it's with themselves feeling comfortable being so and being sexy alone, or whether it's them talking with their partners so they get more of what they need. I'm encouraged by the fact that you invited me on here and that we're having this discussion. And I just wish you and all of your audience just the best. And I want to thank you again for having me. I'm Dr. Madeline, a certified OB national best-selling published author of the book In Control. And I enjoy working with women to help make sure they have accurate GYN information and birth control access so that they can have the most freedom and control that they desire for themselves. So please, by all means, if you guys would like to know more information, follow me. I'm Dr. Madeline on all social media platforms. So thank you so much, Dr. Terralon.
Thank you all so much. So I hope you got all of that. Dr. Madeline, an OBGYN. She's an author. She's a concierge doc. She's, I don't know. She's an entrepreneur. She's a businesswoman. Just call her a boss. But she's also my friend. So I love her so much. Oh, and she's my soror. So shout out to all the deltas who are just doing it. See how we do.
I love you too. I love you too.
So, guys, we're just going to sign off. I'm Dr. Terralon, board-certified family physician, speaker, author, career coach. I help physicians who are seeking lives of freedom, flexibility, and financial independence. You can follow me on all social media platforms at Dr. Terralon. That's DrTerralon. I will see you guys tomorrow and Wednesday for my book launch. That's I Kiss Clinical Medicine Goodbye. You can purchase the book in pre-sales at kissmedicinegoodbye.com. Guys, I'm just so excited. Again, I'll see you tomorrow night when we'll have Dr. Susan. She has a phenomenal story. So she's an MD, JD. She'll tell you how she bounced back after a spinal injury. I just can't wait for you guys to hear her story. And again, I'll see you Wednesday at my book launch. Guys, thanks so much for joining me, and I will see you later. Thanks again, Dr. Madeline. Bye-bye. Everybody be well.
Thank you, Dr. Terralon. See you tomorrow on Wednesday.
Bye. Thank you.